welcome back to my channel. So in my previous video I did promise that I was gonna give you guys more detail about my surgery, and I've had a lot of questions from Instagram and my YouTube channel, and I have them here with me, so I'm gonna address them today in this video. But first things first, my nose. So this is what it looks like from the front. This is my left side, and this is my right side. So it's already been 8 weeks since my surgery, and I couldn't be more happier with my results. So I'm just gonna go straight into the questions that I've been asked. The first question was, who was my doctor? So I did my surgery with Dr. Sertu Sanan. I will put his name down below. You can have a look at his Instagram page, and if you want to do your surgery with him, his details are all on his Instagram. So the reason why I picked Dr. Sertu Sanan was because I did a lot of research and found many doctors in Istanbul. But when I went to Dr. Sertu Sanan's Instagram, I saw a lot of his patients, they had noses like mine. So I felt very comfortable when I saw the results, and I felt very comfortable with him. I then contacted him, and I got through to his assistant, who led me through the whole process. So the first thing was I had to send in pictures of my nose, as well as giving some basic information about myself. I was quoted $3,800. I had to pay a $500 deposit to secure my booking. When I arrived in Istanbul, I had my consultation date booked the same day. So I went immediately after arriving in Istanbul, went to the doctor's surgery and did the consult with him, and he told me exactly what was my issues with my nose and what he was going to do to fix them. So the next day I was then scheduled to go to the hospital. So I did COVID tests and some blood work, and thereafter I had the next day free, and the second day or the third day arriving in Istanbul was my surgery date. So I had to arrive at the hospital at 6:45 in the morning. When I arrived at the hospital, I had to do some paperwork. It was very quick, and then I was taken to my room. And from there I got ready, and the nurse said that she would come get me after 20 minutes and take me to the surgery room. When I got to the surgery room, they just put me onto the operating table. There was a lot of assistants, a lot of the doctor's assistants around me, just like putting on the equipment on my body. And I just remember seeing my doctor, and I told him that I was very nervous at that point, and that's all I can remember. And then I just remember having a dream and getting up, hearing the sound of my doctor. He was just calling me and telling me to wake up and breathe through my mouth, breathe through my mouth. It was a bit scary at that point, because I just got up and everybody's screaming at me to breathe through my mouth, and I was immediately wheeled back into my room. Then a few minutes later, my doctor had come and changed the bandage that I had under my nose. Once the anesthesia started wearing off, I was quite normal. There was no pain. Then about 2 hours after I had woken up, I could eat and have something to drink, and then I could go to the bathroom. Oh, and I didn't mention that 12 hours before your surgery, you should stop eating or drinking, and you should basically do a fast before your surgery. Next one was, how was my experience? So on day 1, I spent at the hospital. Everything was fine. Towards the later part of the night, around 9 p.m., I felt a bit of pain. The doctor gave me a script to get some medicine at the pharmacy. So that's what I did, and I took my medicine and I was good. Let me tell you that I did feel a lot of pain in the first 3 days. It was only on the 4th day that I felt so much better, but the first 3 days was so painful. I did get other people telling me that they just had surgery and there was in no pain, and I don't know how, because I was in a lot of pain for the first 3 days. It was really painful. On day 2, I did feel a lot of pain, but it was manageable. On day 3, it was the worst night. I couldn't sleep at all. I got up at 1 a.m. and I was awake since then, and it just, I don't know if it's my brain that's just reliving what happened in the surgery. I don't know if there's such a thing, but I just felt like my surgery was happening while I was awake and I could feel everything. So that's how day 3 felt. It was the worst. Eating was quite okay. On the first day, I just had like very soft foods. On the second, third day, and thereafter, I could eat. I had to break my foods into smaller pieces just to put them into my mouth, and then I could eat, because I couldn't open my mouth that wide to take a bite of something. Also, guys, after my surgery, I had such bad toothaches. Of course, because of the surgery, then they're drilling on your nose, and just my teeth were in so much of pain. It wasn't that long. I think on day 2 it was gone. From day 4, I felt a lot better. I was eating like normal. I could go out for walks, and I could just basically live my daily life like normal. Only thing I was told that I do too much of exercise, because it could obviously impact the nose. Another question was, could I taste food? Yes, I could taste my food throughout. I could taste my food even after surgery. The only thing that I couldn't really do, and I still struggle with now, is to not breathe, but to smell. Another question was my method of payment. I paid my doctor in US dollars. You can pay in euros or in Turkish lira. It all depends on your doctor. I was also asked if my doctor had used any rib cartilage, and no, he didn't use any rib cartilage, because I was reducing my nose, so I wasn't building my nose, if that makes sense. There was no need to use any rib cartilage. Sleeping positions. So I slept on my back with a travel pillow on my neck for 1 month. I'm usually a side sleeper, and it was really difficult for me to sleep on my back. I had awful back pain throughout the month, and after the 1 month I just went back to sleeping on my side, always just aware of my nose even through the night. I try not to make too much of movement, so I do sleep on my side now, and I haven't had a problem since. So I just want to speak about what I carried in my hospital bag and what I should have carried. Hopefully, if somebody watching this is going for rhinoplasty, I hope that this information really helps you. You need to wear comfortable pajamas, because you're going to be in bed most of the time. If you're in pain like I was, if you're not, I've seen many videos of people just going out immediately and doing some shopping and they felt completely okay. But in my case, I stayed at home for the first 3 days, and I wore very comfortable pajamas, but I would have loved to carry like more button-down shirts that I could just sleep with. The saline spray I found was very cheap in Istanbul. I did carry my own with me, just 1 bottle, but I found it was very cheap in Istanbul. There's no need to carry any medicine or any saline sprays, because you can get everything in Istanbul. And in my 3 days or 4 days, I think I went through 2 bottles of saline spray. So you are going to go through a lot. Maybe you'd want to carry a lot of Q-tips, because I went through a lot. I think each cleaning session you go through at least 10, and you have to clean 3 times a day. So try to carry as much as possible. Another thing to carry is some soft pair of shoes. I found that very helpful during the surgery, and when you get out from surgery, it's just always nice to have soft shoes that you can walk around with. I've watched many YouTube videos, and I've never seen anybody speak about constipation. And I am just generally constipated, and when I take antibiotics, it gets worse. So if you are like me and you struggle with constipation, please carry some medicine or treat your constipation prior to your surgery, because once you start taking the medicine, it just gets worse. So back to my nose. So right now I still feel my tip is very hard, so I cannot make too much of facial expressions because my nose is still very numb, especially on the tip. It's very swollen. My upper lip very close to the nostrils is also still numb, so I cannot really feel that part. So basically the doctor, he did 2 incisions here and here, so that's 3, and that is how it looks. So there's a little bit of redness around my nose, and there is like a slight scar here, but I'm not too worried about that because you cannot really see that. Only if you're like really close, I notice it, but I don't think anybody else notices it around me. Another thing is I cannot get into my nose to clean my nose, so I still use Q-tips. It's been 8 weeks and I still use Q-tips twice a day, sometimes 3 times a day that I clean my nose. And I just finished my saline spray yesterday, and yesterday was exactly 8 weeks since my surgery, so I don't think I'm going to get more. I think I'm just gonna try to wash with water because I feel it doesn't need the saline spray anymore. The only thing I cannot do is too much of strenuous exercise. The doctor said I can start exercising, but I just want to be a little careful when I do exercise that I'm not putting too much of pressure on my nose. So I am taking it a bit easy there, but everything else is pretty much normal. And yeah, and I have to just wait for 10 more months till I see my final result. My doctor did say that I will be able to see most of my results by the 6th month, so I'm just waiting for that. I'm 2 months down and I have 4 months to go. Another question I was asked was, do I regret my surgery? I don't regret it at all. I am so grateful for my doctor and for his assistance. I am really happy with my results, and yeah, so if you guys have any other questions, please list them down below and I can answer them. And if you are going for surgery, I had a few people saying that they are going for surgery in the upcoming weeks, and I wish you all the best, and please take care of yourself, and trust me, it will get better. There are tough days, but everything will be okay. So that's it, and I hope you enjoyed this video. I hope it was informative, and I will see you guys in my next video.